Hello friends, in this video we shall be talking about dopaminergic pathways. The first pathway is the mesocortical pathway, which is also associated with decision making. It is from ventral tegmental area to the prefrontal cortex. Then other one is the mesolimbic pathway. It is associated with reward. It is also known as reward pathway. The third one is the nigrostriatal pathway, which is associated with movement. And the last one is the tuberoinfundibular pathway, which influence the release of prolactin, which has an inhibitory effect on prolactin release. So here you can see the various pathways in this diagram. This is the diagram of first aid. Now let's talk about the different pathways and the diseases associated with it. So first one is the mesocortical pathway. Decreased activity of mesocortical pathway leads to negative symptoms of schizophrenia. For example, anergia, apathy, and lack of spontaneity. Antipsychotics have limited effect. Antipsychotics does not have an effect on negative symptoms of schizophrenia. Atypical antipsychotics have some of the effect, may improve the symptoms of negative symptoms of schizophrenia. The other pathway is mesolimbic pathway. Increase in activity in the mesolimbic pathway leads to the positive symptoms of schizophrenia, such as delusions and hallucinations. It is also associated with addictive properties. The primary therapeutic target of antipsychotics is the mesolimbic pathway, and it decreases the positive symptoms of schizophrenia. The third pathway is nigrostriatal pathway. It is related to the movement. It arises from substantia nigra to the striatum. Decreased activity in this pathway leads to Parkinson's disease. Some of the antipsychotics act on this pathway and decrease its activity leads to the extrapyramidal symptoms such as dystonia, akathisia, Parkinsonism, and tardive dyskinesia. And the fourth one pathway is tuberoinfundibular pathway. Decreased activity of this pathway leads to the increased prolactin level. Therefore, a patient may have decreased libido, sexual dysfunction, galactorrhea, and gynecomastia in males. So, most of the antipsychotics affect the tuberoinfundibular pathway, leads to the increased level of prolactin in such patients, and some of the male patient also presents with gynecomastia. So these are the main dopaminergic pathways.